Good afternoon, everyone. Actually, I came across the Ellavi balloon at a very crucial time during the pandemic, the beginning of the pandemic, where the corporation was the only health services available because many small nursing homes and hospitals had shut down and people had very little place to go. So during these times, Rishit approached me, and I was looking after the National Urban Health Program for Mumbai, and I was also heading the Family Welfare, Mother and Child Health Program in the Municipal Corporation of Mumbai. And we have these regular District Quality Assurance Committee meetings every month, where every maternal mortality case is studied to the minutest detail, and we have experts from all the branches, and we used to, think of what was preventable and what was not preventable. And on that basis, when we were, interacting with my team members, we found that PPH, the cause of deaths were very high. And Ellavi balloon, when it came into picture and the demonstration given, I arranged a demonstration with all the medical officers of maternity homes, 28 maternity homes which are spread all over Mumbai. And we gave them a demonstration, and these maternity homes cater to the urban poor. So the incidence of anemia is very high. And as Dr. Suchitra Pandit Madam just mentioned in her talk, it makes things worse for these urban poor. And we had tried with the gloves and condom catheters and whatnot. But then we were yet losing a lot of mothers post-delivery. And Bakri balloon was something our budget did not permit at all, being very expensive. And with the support from some NGOs and some donors, we could buy these Ellavi balloons. And today it is the number one lifesaver in PPH, and we use it mostly for transferring the patients to higher centers. So during transit, Mumbai being very crowded during the daytime, though the nearest higher center may be just 3 or 4 kilometers. So technically, if we take, it should not take more than 5 to 7 minutes to reach. But due to traffic jams, it can take up to hours. And moving the patient becomes a challenge. And that's why this blessing in disguise, the Ellavi balloon, has saved a lot of lives in the last 2 years. There is a huge demand for this. And it's good news. I just heard from one of the earlier speakers that if NUHM makes provision, under NHM, if there is provision, so we can buy this in bulk and keep it. We have made it mandatory. Of course, we classified our maternity homes based on the number of deliveries, the number of transfers experienced, and based on that, we divided them into their quotas. And there is a high demand, and it is mandatory that there should be at least 5 balloons, waiting for every mother who may require it. So I thank Rishit for giving us a wonderful product where at least we are not losing mothers because of PPH. And especially we are not, even the doctors receiving at higher centers are very happy to seeing the Ellavi balloon, which has controlled the bleeding of the mother. So it makes things simpler for them to receive and they have to put in very little efforts, and they have to just monitor and arrange for the blood if required. That too on standby. Earlier this was not the picture. There would be a lot of cursing from the higher centers to the lower centers for not taking proper precaution or for not using other methods to control the bleeding. But with the Ellavi balloon, these mothers are welcome, and that has become a very positive thing. So thank you, Rishit, and that's all.